All right, Pharmacist Interventions, Part 29. I was filling a prescription for Descovy 1/2015 for a male in his 20s. Descovy is a branded medication. It's a mix of two medications, emtricitabine and tenofovir alafenamide fumarate. These are two nucleoside reverse transcriptase inhibitors. We use this to prevent HIV. It inhibits the replication of it, so we use it as PrEP. This is pre-exposure prophylaxis. They're antiretrovirals, but this is the pediatric dose. Oh yeah, the dose 1/2015 is for if you're less than 25 kilograms. The dose for an adult is 225. 25 kilograms is about 55 pounds, by the way. So yeah, HIV pre-exposure prophylaxis is basically when you take Descovy every single day. There's other regimens, but taking it every day and you're having, like, say, unprotected sex or high-risk sexual activities, it's to prevent getting HIV. So yeah, that's not good because you need to have a drug at a certain concentration in order to prevent, like, HIV. Also add that you can pair drugs like Descovy or like Truvada with like an integrase inhibitor to treat HIV. So yeah, that's why it has a pediatric indication. It's used for HIV treatment too. But this one, I ended up sending a fax to the doctor telling them, like, this is not the right dose. All right, so my next intervention, I do like to make clinical interventions. That's like my favorite thing to sort of show on TikTok and Facebook and stuff like that. But I also make other sort of interventions for my patients. The next intervention that I've had lately, I have a regular patient, he's deaf, and he was picking up his Eliquis, and it was for a 3-month supply. It was $930. I looked at that, and I looked at him, and I wrote down on a sheet of paper, like, hold on, I'm gonna find you a coupon, because I'm not about to have this man paid $930 for his Eliquis. I'll also mention, I think it was like when I worked a weekend, I do like a 12-hour shift, like a 7 to 7 on a weekend, and I think I had like one technician, and I had a line of like 10 people at the pickup, and of course a line in the drive-thru. It's very hard for pharmacists to do sort of things like this, like sign people up for like coupon cards and payment assistance programs, but I was like, I have to do this. I'm not letting him pay that much. So it took a little time. I put in his name, his address, his phone number, his email. I helped him like sign up for a manufacturer coupon for Eliquis. And then when I ran it, boom, $30 for a 90-day supply. Also mentioned with like manufacturer coupons, like with brands like Eliquis and Xarelto and Ozempic, stuff like that, you can't bill it with like Medicare. You can only bill it with commercial plans. Little tangent, but I've noticed the copays for my Medicare patients on branded medications are like so high right now. Like every time I have someone pick up like their COPD inhaler or their blood thinner, it's like so expensive. Like I know it just changed with like the max out of pocket being $2,000 for Medicare Part D patients, and then also they took out the donut hole, but like I feel like a lot of these patients are seeing pretty high copays on the front end. So if any of you guys have other information about like what to expect with copays after that $2,000 like deductible is met, like let me know, because I don't think it's like a max out of pocket like cap. I still think these patients are having to pay for their medications after that $2,000 like thing is met.